Now, another why question in COPD is why COPD patients do this pursed lip breathing, especially patients with emphysema. Okay, remember in COPD patients, in emphysema patients, their small airways are weak or floppy. It means, see, when a normal person is expiring, okay, the airways will not collapse. But in patients of emphysema, when a person is trying to expire because the walls are weak and the external pressure, surrounding pressure from the lung parenchyma is high, the airways will collapse, so that obstructs the expiration. Clear? So in normal expiration, the normal physics is always remember airflow will depend upon pressure differences. So there is high pressure in the lung compared to the pressure inside the mouth. So what will happen? The air will move from lungs to the oral cavity, then it will go out, right? So it always moves from high pressure to, so the high pressure area to low pressure area in the mouth, and it goes out. Clear? But in COPD patients, remember, so when a person is expiring, okay, the the pressure drops in the airways. At some point, what happens is airway pressure will be less compared to external pressure, so the bronchus will collapse. Clear? Meaning the small airways will collapse. So when a person does this pursed lip meaning as if you're blowing a candle, you close the mouth, right? See, you can see here. If this is a airway, okay, I think I'll use the red color so that you can understand here. See, this is a, instead of keeping the airway open, continuously open, we are slightly closing it. Okay, we are closing the mouth and blowing out slowly. This is called pursed lip. Okay, what happens is when you narrow your lips, you increase the resistance at the mouth, right? So air cannot easily go out as happens here. Air will be slowly slowed down here. This creates a back pressure. Okay, so the pressure in the airways will increase, and that will keep the airway open. See, now when we expire, no, always remember when we try to blow out the air out, the pressure usually drops inside the airways, and the surrounding pressure will compress our airways, and it will narrow down like this. But now when a person is using this pursed lip, what happens, because the air is not able to rush out, the air is slowly going out, the air is getting trapped inside the airways, and it will keep, that pressure will keep your airways open. It is something like, if I want to give an example, you're partially closing a pipe. There is a pipe here, the water is gushing out, you are trying to close the pipe here. What will happen? The pressure will start building upstream, right? Behind here in all this area, the pressure will start building. Same thing applies, happens to your airways. You are trying to narrow the exit, so the pressure starts building inside the airways, and it will not collapse. It will also keep the alveoli open. Otherwise, if the air, all the air goes out, what will happen? The surrounding pressure will increase, and it will collapse your airways. So it's very important, remember, when a patient uses this pursed lip, airway pressure stays higher for a longer time. This will prevent the collapse of alveoli. More air will be expelled out, and less air trapping happens, and breathing becomes easier. Okay, remember this. This is a very simple one. Instead of letting the air rush out and collapse the pipe, what we are doing is we are letting the air go out slowly and keep the pipe open.